Hello everyone. In last part, we have seen about general signs and symptoms of malaria, differential clinical features of each plasmodium larvae, and diagnosis of malaria. So in this part, we will see about risk factors, complications, and some additional information about malaria, and a possible Ayurvedic interpretation of malaria. Myself, Dr. Anandas, Assistant Professor, Department of Roga Nidhan and Vigrati Vignan, Global Institute of Ayurveda, Rajkot. Risk factors of malaria. First point is immune system deficiency. People who have immune system deficiencies, including HIV, are more likely to experience severe effects of the infection. So those kind of people already suffering from disease like HIV and all, or any other type of diseases which will be genetically susceptible or immunocompromised conditions, the infection will be affecting more severely in nature. Next point, pregnancy. Women who are pregnant are at increased risk of malaria infection. There are several proposed reasons for this, including a lowered immune system which can reactivate previous infection, or a lowered immune system which makes it more likely for pregnant women to develop the illness. So two reasons are explained for infection in case of pregnancy condition, especially in a pregnant woman, their immune system will be very weak in nature. So this weakness of the immune system will cause reactivation of the previous infection. Or in other words, a lowered immune system will make more favorable condition for this kind of infection, and the disease will be manifesting more easier in that kind of people. Newborn babies, transmission from their mother. Some babies may be born with a malaria infection, acquiring the parasite from the mother and not from a mosquito vector. So rather than receiving the parasite from a mosquito, from direct transmission will be happening, especially in case of newborn babies, infant cases, transmission from mother, from the blood of the mother to the fetus. Blood transfusion. There have been reports of malaria infections that have spread from one person to another through blood transfusions. In these instances, a blood donor who has acquired an infection, usually from a mosquito vector, typically has not yet developed symptoms of the illness. So, especially through the blood transmission or blood transfusion, what will be happening? A person who is a donor already will be affected with this kind of infection, but typically symptoms will not be present there. But without knowing this reason, that person will be donate the blood to another person. Through that, it will be transmitting. The transfer of blood cells which are infected with a parasitic organism can then allow the parasite to thrive inside the body of the recipient of the blood transfusion. So anyhow, the parasite which is causing for the further infection will be transmitted from one person to another person through the blood transfusion, and through the donor's blood it will travel to the recipient's blood circulation, and there it will be further matured. Lifestyle factors. Malaria is an infection that is predominantly spread in certain geographic regions with a tropical climate and an abundance of still water where the mosquito vector that carries the parasite can survive. So, depends upon the status of the environment, especially stagnant water and the certain climate change will helpful for the further maturation and growth of the malaria larvae. Living in a region with a high rate of malaria. Living in a region that is known for malaria substantially increases the risk of becoming infected. So the place which is more prone to infection of malaria, that will be causing further more severe condition. While it has been noted that some people living in regions with a higher rate of malaria may become immune, many otherwise healthy people with normal immune systems experience serious complications and may die from the infection. So, in two aspects, it can be affecting, especially people who are living in a region with a high rate of malaria. They will susceptible with that condition. They will acquire that kind of immunity throughout living in that regions. And in some areas, what will be happening? The people with normal immune systems, in that kind of people or in that category of people, they will affect with several kinds of infections of malaria. Visiting a region with a high rate of malaria, especially travelers who visit region with a high rate of malaria may become infected, and in that cases particularly because travelers who have not been exposed to the infection before have not developed immunity to the condition. So the persons who are newly visiting a place or visitors or travelers, whatever it may be, they will infect with that conditions if they visited an high rate of malaria regions. Environmental factors. Some factors increase exposure to malaria, including a lack of protective clothing, exposed sleeping accommodations, lack of insect repellent, and lack of immunization. So these factors will aid in conditions like environmental factors, which will be causing further infection of malaria. Next is complications of malaria. Among several serious complications, development of respiratory distress, which occurs in up to 25% of adults and 40% of children with severe plasmodium falciparum malaria. Acute respiratory distress syndrome occurs in 5 to 25% of adults and up to 29% of pregnant women. And a co-infection also will be occurred, especially a co-infection of HIV with the malaria increases mortality. This will cause high rate of death. Malaria in pregnant women is an important cause of stillbirth, infant mortality, abortion, and low birth weight of the infants, particularly in Plasmodium falciparum infection, but also in Plasmodium vivax species also. Infection with the Plasmodium falciparum may result in cerebral malaria, a form of severe malaria that involves encephalopathy. So, especially Plasmodium falciparum species, which will result for cerebral malaria, and a form of cerebral malaria that involves encephalopathy. It is associated with the retinal whitening. The character features will be retinal whitening, which may be a useful clinical sign in distinguishing malaria from other causes of malaria. So, retinal whitening will be a significant distinguishing feature. Enlarged spleen, enlarged liver, or both of these conditions will be other distinguishing factors, along with the severe headache, low blood sugar, and hemoglobin in the urine with renal failure may occur in some conditions. Complications may include spontaneous bleeding, coagulopathic disorders, and shock also. Here we will see some additional informations. National Malaria Eradication Program (NMEP). National Malaria Eradication Program was launched in United States on July 1st, 1947. The NMEP was directed by the Federal Communicable Disease Center (CDC). What they have done, first of all, DDT was applied to the interior surface of rural homes or entire premises in countries where malaria was reported to have been prevalent in recent years. That was their first line of attack against the malarial infection. In addition, wetland drainage, removal of mosquito breeding sites, and DDT spraying occasionally from aircraft were all persuaded under the guidance of a CDC, Communicable Disease Center. By 1951, malaria was considered eliminated altogether from the country, and the Communicable Disease Center gradually withdrew from active participation, and thereby they stopped their activities in the operational phase of the program, shifting its interest to surveillance. So, this much are the common functions and common activities which are performed by the CDC under National Malaria Eradication. World Malaria Day. World Malaria Day is an international observance commemorated every year on April 25th and recognizes global efforts to control malaria. So, April 25th is the World Malaria Day. In addition to, as a remembrance of global efforts which has taken over for to control malaria. World Malaria Day sprung out of the efforts taking places across the African continent to commemorate African Malaria Day, especially for the malaria infections which have been affected over the African regions. African Malaria Day also has been commemorated especially. World Malaria Day is one of 8 official global public health campaigns currently marked by the World Health Organization (WHO), along with the World Health Day, World Tuberculosis Day, World AIDS Day, and so on. Ayurvedic understanding regarding malaria with respect to the concept of Vishamajuara, with respect to the concept of Saprathyanika and Nishprathyanika Jwara, and with respect to the concept of Agantujwara, we can correlate possible interpretation with respect to malaria. Vishamajuara, especially types of Vishamajuara, within that we can correlate with the concept of malaria. With respect to the types of Vishamajuara, especially Sandata, Satata, Anya, Dushka, Tridiyaka, and Chaturtaka, we will see each features of each Vishamajuara type. First of all, Sandata. Aggravated doshas will spread all over the body through Rasavaga Srotas, and Gurutva of doshas will cause Sangha in especially Srotas. That will be the Karana of Santata Jwara. And Lakshanas will be continuous fever for 7, 10, 12 days. That will be the main Lakshana. Satataka Jwara will be, especially Raktadadu Asra will be there in Satata Jwara, counteracts with the Kala Vriddhi and Chaya features. And Lakshana will be rise of Jwara twice in one day. Anyadushka, Metapaka Srotoshti in Raktasira especially, and intensity depends on Kala, Prakriti and Dosha effusively. And the Lakshana will be fever only once in a day. That will be the presentation of the fever. Tridiyaka, Dushti in Mamsapaka Srotas especially, and Jwara once in third day. That will be the presentation onset of Jwara. Chaturtaka, Dushti of Medas, Asti and Majjapaka Srotas. Jwara once every fourth. This will be the Lakshana of Chaturtaka. So depends upon the condition of the patient, depends upon the condition of the Lakshana and the onset of the Jwara, periodicity, for how many days it is occurring and for how many days it is long lasting, depends upon that. We can correlate with other, along with other conditions like a formation of any kind of manifestation with respect to the body or any other conditions with respect to any other systems of body. We can correlate with the types of Vishamachara. This will be one possible interpretation with respect to malaria infection and Vishamachara. In Saprathiniga and Nishprathiniga Jwara, especially Santata Jwara, we can consider first of all. It will be Nishprathini with respect to Tulya Kara Dosha Prakriti Dosha, with respect to the indulgence in Tulya Kala Dosha Prakriti Dosha, especially with respect to the Kala, Dosha, Prakriti and Dosha. It will be accommodating with the equal participation. And the nature of the fever will be in continuous in nature. That is Santata Jwara with respect to Saprathiniga and with respect to Sadada, Anyadushka, Chaturtaka, Tridiyagachara, from the classification of Vishamachara itself, if it is Sapratiniga, Kala Vriddhi Chayatmakam will be classified, and type of onset of fever it will be intermittent in nature. Agantuja Jwara, the other possible classification or correlation. Types will be Abhigata, especially Karana will be Abhigata due to sharp instruments or metal, Prakopita Vata because of involvement of Prakopita Vata because of the above said reasons. Ektadushti will be happening, and the Lakshana will be Shula, Shodha, Vaibarnya with the Jwara. Along with the Abhishanka Jwara, Kama, involvement of Kama, Shoka, Bhaya, Krodha, Visha, Karanas. Lakshanas will be manifesting like a Brahma, Aruchi, Daha, Anidya, Tantra, Vaivarni. Abhichara Jara, Abhichara because of Abhichara Prayoga, especially through witchcraft or power spell, and the Lakshanas will be Trishna, Brahma, Daha. Abhishabaja due to calls from the god or teacher. Lakshanas will be interpreting like a Lakshanas pertaining to the Doshtushti. So it depends upon the Lakshanas, especially manifesting over the body. If it is related with the Jwara or if it is related with the fever, what kind of features are representing over the body of the patient, that you can possibly correlate with any kind of Jwara also. Rather than considering the Karana, if it is an idiopathic cause also, you should go with the clarification of a Lakshana in some cases of infective fever conditions. So this much regarding the topic malaria. We will finish here. Hope all of you have understood with the topic. Thank you.